Hello everyone, this is Dr. Tamali Chakravarti, consultant physiotherapist at Apollo Home Care. Today I am going to discuss about the COVID rehabilitation protocol. In this video, today I'll show you few exercises. All these exercises we can perform at our home only and maintain our lung health. People who are mild, moderate and severely affected, they can perform all these exercises to recover from this condition. So let's see what are the exercises we should do during our COVID infection period, quarantine period, and after recovering. So let's go. So let's begin with our exercise number 1, which is pursely breathing. It's a deep breathing exercise technique. What we need to do in this exercise, we need to inhale through our nose, hold for 5 seconds and exhale through our mouth as if we are blowing a candle, like this way. Let's go. Inhalation period should be 4 seconds and exhalation period should be 6 seconds. So let's begin. You should repeat this exercise 10 times at a time, in 10 times and twice a day. Now let's begin with our exercise number 2, which is diaphragmatic breathing technique. In this exercise, what we need to do, we should keep one palm on chest, another on the upper abdominal wall. We really need to concentrate during this exercise. We need to follow the inhalation exhalation pattern. During the inhalation, our abdominal wall goes up, and during the exhalation, abdominal wall shrinking. So we need to really concentrate. Okay, let's begin with the exercise. Inhalation, same way through our nose. Let me tell you one thing. Diaphragm is the one of the major muscle which helps in our inspiration and expiration. So we need to train that muscle during after any infection. We need to train that muscle so that it can function properly. So diaphragmatic breathing technique is one of the major breathing technique we should perform during our infection period or quarantine period. Let's begin with the exercise number 3, that is apical breathing technique, in which we need to keep our palm in a crossway position. It should not go upward. In this position, the upper lobe, the apical part of the lung, is situated inside this part. So what we will do, we will breathe in, hold our breath for 5 seconds and give a gentle mild compression over this area and exhale. Same way, exhale through your mouth. So let's begin. This was our apical breathing technique. And the next one, the 4th number, is the causal breathing technique. What we need to do, we need to grab our rib cage like this way. Okay, in the apical breathing, we are giving anterior posterior pressure. In the causal breathing technique, what we need to do, we will give a lateromedial pressure. We will grab the rib cage like this way, inhale, hold and give a compression and exhale through your mouth. So let's see. This was our causal breathing technique. I have shown you 4 breathing techniques. Now we will perform a few other breathing exercises through a few easily available instrument. The one is with the balloon. What we need to do, we need to exhale, or we need to flare up the balloon and then inhale through your nose. Okay, let's see how we can do this exercise. this exercise we can do easily with the help of balloon to condition our lung. The another exercise, we can use a glass of water and a straw. What we need to do, we will just form some bubbles like this way and then again inhale. Okay, let's do it. So this is the exercise with the glass of water and straw and this balloon. These things are very easily available. We can perform it in our quarantine period. The another most important exercise is with the spirometer. You can get it in any pharmacy or online. See, here 3 balls are there, and 600cc, 900cc and 1200cc is written over this spirometer. This is called incentive spirometer. Through this instrument, we can self-observe our lung capacity. So what we need, this is the mouthpiece. We need to hold it and then we need to inhale. So when we are inhaling, the ball goes up. So maybe the very first day it is not possible for a COVID infected patient to raise 3 of these. So don't worry, gradually it will improve. So very first, don't force too much yourself. Do it in your comfortable range. So what we will do, we'll grab this. If 2 ball goes up, that's mean 900cc amount air is, we can take up to 900cc amount of air. So the next one, the next target after this thing, the next target, we need to hold the ball in the air, in the upward position. That's mean we can hold the air in our lungs. Initially we will start with 3 seconds, and according to the condition we can improve it. Let's see how. Right now I was holding for it 5 seconds, and this is depend on the patient cardiorespiratory endurance. So you can do according your strength, according your condition. So, and one thing I should suggest, if there is any complication, any problem during all these exercises, stop the exercises immediately and consult with your chest physiotherapist or your chest physician so that they can diagnose your problem. Till then, goodbye. Ta-da.